Welcome friend, welcome to our channel Quality Guru. Friend, our topic is contamination and cross contamination. Contamination is the unintended presence of any foreign substances or organism in a product. While on the other hand, cross contamination is a specific type of contamination where substances from one product or process transfer to another, jeopardizing patient safety and product integrity. Key sources include raw material, contaminated equipment, environmental factor, and personal hygiene. Prevention requires a multifaceted approach including strict hygiene and governing protocols, validated cleaning procedures, dedicated facilities, and equipment for potent compound control environment, and through training for all personnel. Origin and history. Early recognition of hazard. The pharmaceutical industry has always faced risks from physical, chemical, and microbial contamination. Early concerns were elevated in the late 1970s following several outbreaks linked to intravenous IV products. The large volume parenteral outbreak 1971 to 1973. A series of severe patient infections and deaths were linked to contaminated intravenous solutions such as large volume parenteral and D5LR, that is 5% dextrose in lactated ringer solutions. Regulatory response. These events prompted the FDA to conduct intensive review of manufacturing process and initiate comprehensive industry-wide discussion to identify root cause and implement control for microbiological quality. Emphasizes on validation and control. This era saw the beginning of a push for formal validation of processes, equipment, and manufacturing environment, laying the groundwork for a rigorous quality system in place today. Contamination and cross-contamination in pharmaceutical industry became a significant concern following historical incidents like the 1971 to 1973 LVP contamination outbreak, which revealed inherent risk from personal equipment, air, and water in drug manufacturing. These events highlighted shortcomings in manufacturing practices and lead to increased regulatory scrutiny and the development of strategies like good manufacturing practices, enhanced cleaning procedures, and validation processes to control contamination for both within the process and external source, and ensuring patient safety and drug quality. Type of contamination: chemical contamination, microbial contamination, physical contamination. With respect to chemical contamination, unwanted transfer of chemical residue, cleaning agent, or substances from other products. With respect to microbial contamination, the introduction of microorganisms like bacteria, fungi, and viruses, often from inadequate sterilization or poor hygiene. Physical contamination: presence of foreign particle, fibers, or debris in a product. Source of contamination: raw material, equipment, personnel. Through environment, through cross contamination. Through raw material: impurity or contamination within the active pharmaceutical ingredient, that is API or excipient themselves. Contamination through equipment: residue left on improper clean or share equipment, or particles shed from equipment surfaces. Say for example, line cleanse failure. Contamination through personnel: direct contact with product material due to inadequate hygiene, incorrect gowning, or the transfer of contaminants by a hand, clothing, or personal item. Contamination through environment: contaminants in the air, water, or surfaces of the manufacturing facility if not properly controlled. Cross contamination: a specific type of contamination where a product comes into contact with another product or its residue due to inadequate separation in manufacturing process or shared facility. Prevention strategies: through strict hygiene, validated cleaning procedure, dedicated facility and equipment, environmental control, personal training, cleaning validation. Prevention through strict hygiene, mandating thorough hand washing, proper gowning, and the use of personal protective equipment, that is PPE, for all personnel. Prevention through validating cleaning procedure, implementing and validating rigorous cleaning processes for all equipment to ensure the removal of residue between production run. Prevention through dedicated facility and equipment, utilizing separate self-contained facility and equipment for high-risk products like antibiotic, hormones or cytotoxic drugs. Prevention through environmental control, designing and maintaining facility with smooth, easy to clean surface, control air pressure differential and separate airlock for material and personal entry. Prevention strategy through personal training, providing comprehensive and ongoing training to all employees on good manufacturing practices, for hygiene standards and specific contamination prevention protocols. Through cleaning validation, a systematic methodology to confirm that cleaning procedures effectively remove residue to acceptable level. Key development and control. Good manufacturing practices, clean room technology, validation, risk management, dedicated facility and campaign manufacturing. Control through good manufacturing practices. These regulations and guidelines are crucial for ensuring drug products are consistently produced and controlled according to quality standards, minimizing contamination risk. Control through clean room technology. The development and application of sophisticated clean room with control environment and air handling system, that is HVAC. Control through validation. The process of proving that a manufacturing process, piece of equipment or system consistently perform as intended, a critical step to prevent contamination. Control through risk management, a systematic approach to identifying, evaluating and controlling potential risk of contamination and cross-contamination throughout the product life cycle. Control through dedicated facility and campaign manufacturing. The shift from only dedicated facility to a more flexible approach, including campaign manufacturing in shared facility, provided such operations are fully separated to prevent cross-contamination. Example of contamination: hair on tablet. A worker's hair falling onto a tablet during manufacturing or packaging. Dust or dirt in a sterile area. Unfiltered air allowing dust particle or dirt to enter in a clean room. Contaminated raw material. Raw material from a supplier that are infested with paste or contain impurities. Airborne particle. Airborne contaminants from outside the facility entering through inadequate ventilation or filtration. Example of cross-contamination: equipment not cleaned properly. Fragment of residue of a previous drug product remaining on manufacturing equipment and contaminating the next batch. As we already told, the example of failure in line cleanse. Improper storage: storing a recovered solvent in a drum that was not properly cleaned, leading to contamination of solvent. Personal practices: a worker touching a contaminated surface and then handling a different product, transferring the contaminants. Environmental factor: contaminated air from inadequate HVAC system or paste dropping in air handling units spreading to production area. Mix up in packaging: packaging the wrong product or using packaging that is similar to another product, leading to product being mixed with another product. Mitigating risk and ensuring patient safety. Contamination and cross-contamination can lead to adverse effect on patient health, which may be sometimes fatal, costly recall and damage to a company reputation. To address and mitigate the risk of contamination and cross-contamination, regulatory agencies have established guidelines to maintain stringent control throughout the product life cycle. Good manufacturing practices. GMP guidelines such as ones by WHO and the International Council for harmonization, that is ICH, emphasizes the need for comprehensive quality management system, adequate facility design, equipment design, maintenance, personal training, and other aspect procedure. These guidelines establish a detailed and robust framework for preventing contamination and cross-contamination in the pharmaceutical industry. Annex 2, Manufacturer of Sterile Manufacturing Product. This guideline, published by EMA, European Medicine Agency, addresses the specific requirement for the manufacturing of sterile product. It provides detailed recommendation for clean room design, environmental monitoring, personal behavior, and aseptic processing technique, ensuring the prevention of contamination in sterile manufacturing. The new version of Annex 1 has been expanded considerably and now contains a stronger focus on the implementation of contamination control strategy. It takes an improved risk-centering approach in contrast to the more regulatory mindset of the prior version. Risk assessment. Quality risk management approach outlined in ICH 9 play a crucial role in identifying and mitigating contamination and cross-contamination risk by systematically analyzing potential hazards, evaluating their severity, and implementing appropriate control measures. We can proactively manage contamination risk in a systematic and efficient manner. Exclusive guideline and document. There are also some exclusive guidelines and documents on cross-contamination which may provide important principles on contamination control. For example, the PICS title Cross-Contamination in Shared Facility is one such document that provides information for assessing the risks associated with cross-contamination in shared facility. Contamination and cross-contamination can occur at various stages of pharmaceutical manufacturing processes, from raw material handling to finished product packaging. To effectively control and mitigate these risks, it is crucial to take a holistic view of the entire process. To prevent and control these risks, the following design and the process control should be implemented. Thanks a lot, and keep watching our channel Quality Guru.